So you want to practice myofunctional therapy in your dental office, but you don't know where to start? No worries. I have exactly the answers that you need with your 5 W's of myofunctional therapy. I'm Carice Laguerre. I'm a myofunctional therapist, key opinion leader, and educator on all things sleep and myofunctional therapy. And I've got your who, what, where, when, why, and bonus how to implement myofunctional therapy in your dental practice. So let's dive in with who can practice myofunctional therapy in the dental office. Well, no surprises here. Dentists and registered dental hygienists are eligible to take many different courses and do practice myofunctional therapy in a lot of practices. However, registered dental assistants are eligible to take some courses and do practice myofunctional therapy in dental offices across the nation. What is myofunctional therapy? It is a wonderful adjunctive service that actually originated in the early 20th century under the tutelage of Edward Engel. Dr. Alfred Rogers did a lot of research about the soft tissue pressures of the lips, the cheeks, and the tongue, and how they impact the stability of the teeth and the periodontium. Where can you practice myofunctional therapy? You can practice myofunctional therapy in your dental office if you have a traditional office type space. So as long as you have a desk and 2 chairs, it is a wonderful setting upon which you are able to implement myofunctional therapy. And there's a lot of different supplies that you probably already have currently in your office. When can you do myofunctional therapy? Myofunctional therapy is not a part of any of the Dental State Practice Acts in any of the 50 states of the Americas. However, myofunctional therapy is really great to practice when your practitioner is not doing clinical dentistry. Okay. So if it is happening in the dental office, it just needs to be separate. So have a separate schedule, have a separate designated hours and times, and you can practice myofunctional therapy in your dental office with no concerns at all of disturbing, disrupting, or otherwise making it known to your board that you are doing something that is out of a scope. So as long as it's separate, it's entirely under the rule. There are several states that have had it come up, and including Texas, Maryland, and Iowa, who have determined that it just needs to be separate. So practice safely, practice separate. Why would you practice myofunctional therapy in your dental office? Well, KPMG, a leading consulting firm globally, in conjunction with EY and Deloitte, have some research that they put out in 2022 that alternative adjunctive services, such as myofunctional therapy, along with some others, will wind up being a $2.5 billion industry by 2027. By 2027, that's right around the corner. And all this time, you could be building up and building on the increased demand for integrative services and more holistic health offerings in the dental practice. It is a wonderful way to help complement your traditional restorative services and to help your patients that have TMD, parafunctional habits, and orthodontic treatment. How would you implement myofunctional therapy in your dental office? I highly recommend the MyoPathway course. MyoPathway is the first and only myofunctional therapy course that in the price of tuition is included not 1, but 2 days, 2 8-hour days of on-site in practice mentorship to allow you the time to implement systems and operations within your workflow that can optimize and make your myofunctional therapy as profitable as possible. Not to mention that the course also has 28 hours of AGD PACE credits. It offers certification, and it includes not only just the basics of myofunctional therapy, but all the essentials like practice integration and knowledge that you need to know to implement effectively. How do you bill out to medical insurance? What is it like to work with appliances and work with orthodontic cases? How do you talk to the patient to increase case acceptance? And how are you going to optimize your myofunctional therapy services with alternative modalities such as breathwork and cranial nerve integration? It is the by far best offering of myofunctional therapy implementation for dental practice owners. So if you are interested in learning more about MyoPathway, I invite you to visit myopathway.com and feel free to reach out with any questions. I am happy to guide you and to answer any of the other questions that you might have about myofunctional therapy going forward. I look forward to watching you thrive implementing myofunctional therapy in your dental practice.